I'm going to tell you a little bit about the common procedure that we perform mostly in our rooms, and it's a gastroscopy. Now, the common indications for a gastroscopy, why someone might refer you to our practice for a gastroscopy, would be peptic ulcer disease or gastroesophageal reflux disease like heartburn. Sometimes we perform gastroscopies for bleeding as well, bleeding ulcers, or when you're vomiting blood. So symptoms that you may experience that may prompt us to do a gastroscopy would include heartburn, and often you may experience upper abdominal pain or chest pain that is not typically like a heart attack. Then we may want to perform a gastroscopy to look for reasons why you're having those symptoms. Other symptoms that would prompt us to do a gastroscopy would include nausea and vomiting that's unexplained, or difficulty in swallowing, and often with associated weight loss. The procedure is a short procedure of 10 to 15 minutes mostly, and is mostly performed in our rooms, as I said, by an endoscopist, which would be me or my partners, a registered nurse who helps during the procedure, and an anaesthetist for the sedation. The sedation is not a full anesthetic, but it does require you to be taken home by somebody else. You may not drive after the procedure, so it is recommended that you have someone bring you to the rooms and fetch you to take you home afterwards. The procedure is performed with an endoscope. The endoscope is about the size of my small finger, or about 6 to 7 millimeters in diameter. The scope is passed through the mouth into the esophagus and the stomach, and then we go down up to the first part of the small intestine, which is called the duodenum. We can often see the pathology, and would often also take small biopsies of the stomach wall. These are not painful, and they hardly ever cause any complication, but you do need to look out for bleeding after the procedure. The results will be discussed with you immediately after the procedure, when you're awake, after you've recovered from the sedation, and you may have to come back in a week or so for the results of the biopsies that we took during the procedure. It is normal to feel some discomfort in the throat after the procedure because of the endoscope passing through the back of the mouth, and you may experience some bloating because we blow in air during the procedure so that we can visualize the stomach lining. You must alert your doctor immediately if you experience any of the following symptoms, which may include worsening chest pain or abdominal pain, dark or tar-like stools, and persistent vomiting or vomiting of blood, shortness of breath, or a high temperature. Thank you very much. We look forward to welcoming you in the rooms, and there will be time before the procedure to ask any questions that you may have, and we'd be more than willing to answer those. Thank you.